I don't like to sit down when I talk. I usually get up and move around. Just a little bit about the National Alliance of Mental Illness. It started in 1979 when a group of parents who had adult children still struggling with serious mental illness kind of got together, and it grew from that to an organization today that is not only within the 50 United States, but is in several other countries as well. We have 3 levels of NAMI. We have NAMI, the national level, NAMI North Carolina here in North Carolina, and our local affiliate, NAMI Appalachian South. There's 3 main focuses of NAMI. In addition to the fact that they also support research for the causes and treatment of mental illness. That's a kind of a 4th little thing that they do, but the 3 main focuses are education, support, and advocacy. Under education, there are a number of educational programs that NAMI has developed. We have several of them here locally. One of them is called Family to Family, and that's a 12-week class, very intensive class, lots of information that is given to family members of those with mental illness so that they can support their relative with mental illness in a positive way and also take care of themselves in the process. I've been there, done that with a very ill relative, and it can take a toll on your own personal health when that happens. And so it's a combination of helping you support yourself and your family member. We have the peer-to-peer class that's for the people who have a mental illness. Let me go back to family to family. Family to family is taught by family members who have themselves gone through the process of supporting a family member with mental illness, and they've received special training. Same way with peer-to-peer. Peer-to-peer is taught by people who have a mental illness, are in a good place in their recovery, and then can teach the information that is helpful to those who are taking their journey of recovery. It's a good class. I took it. I learned a lot in that one. Another educational program, and one we've been doing a lot of recently, is called In Our Own Voice, Living with Mental Illness. This is an interactive program where those of us who have mental illness and are in a good place in our recovery are trained to go out and talk to groups. We have a DVD with a lot of clips of people, starting with dark days, acceptance, treatment, coping skills, successes, hopes, and dreams. It shows that, yes, you can go through hard times and rough times, but you can also, through a process, learn to be successful and see your dreams come true. We've been doing that one. As of this afternoon, we have presented in every high school, every 9th grade health class in every high school in Macon County. Almost 200 students that we have presented this program to as of this afternoon. Donita and I went out to Nantahala this afternoon and did that. It's an excellent program, but it can be for any group. And there's information up there on that. Donita is now an official trainer of people, for people. She went to Washington, D.C. to receive training, to be a trainer of those people who will be presenting in our own voice. So we're going to be having some more trainings here, and so that will make it more available to whoever would like to have this program. It takes about an hour to an hour and a half. One of the other things that we have been trained to do but haven't quite been able to put into place is parents and teachers as allies. We had this all together last year. A crisis happened with the person in charge, and we had to delay that and hope to do that. It talks about children in school and helping parents and teachers working together to help a student with their challenges. Another program that NAMI has embraced but not developed is Crisis Intervention Team Training for Law Enforcement Personnel, CIT. Smokey helps with that. NAMI is CIT was started by a law enforcement person in Memphis, Tennessee, to help law enforcement people who interact with people in mental health or substance use crises to interact in a more informed way and in a way that will be helpful and beneficial to everyone involved. And it's a 40-hour class. Many of our people in the Sheriff's Department have received this training here in Macon County. We also have a lot of information. We have a lot of it back here. If you want to see some of the information that we have information on all sorts of things. NAMI has expanded to talk about young children through older people and the full gamut in between. Support. Support is crucial for those of us who have a mental illness. Support is a key to our success in recovery. We have, at the local level, we have a support group every week on a Thursday. We have information about that. Tonight, most of our people from the support group are here supporting us. So we do have them every Thursday night at Memorial Methodist Church right now. We have a support group because support is key. There's also call-in numbers for NAMI National and NAMI North Carolina. We have some numbers for those of us who make ourselves available to offer support by phone. Advocacy. Yes, there we go. Okay, I went on the NAMI National website and I looked under their public policy platform. This, 70-some pages, is NAMI's public policy platform.
My version's a lot better.
It covers many, many different issues that NAMI is advocating for in the government, helping us advocate for it in our communities. So advocacy is a huge part. There's some paid lobbyists in NAMI National, paid lobbyists in NAMI North Carolina. No paid lobbyists here, we just advocate. One of the things that we have advocated for and recently have been able to have is a NAMI support group in the detention center for the women. That has been going on now for about a month, 6 weeks, since February. And so that's one of our advocacies that we have been able to do here. There's a lot of other things that we advocate for. We go to the Mental Health Task Force and speak up in the Mental Health Task Force. I belong to the Consumer and Family Advisory Committee, which is a group of volunteer family members and people who have mental illness, substance use, or intellectual and developmental disabilities, who advise Smoky Mountain Center on what we think about what they're doing. We say yes or no. Most of the time you're doing a good job, but we give them feedback. So that's another advocacy avenue that we have. And I'll turn the time over to Donita. I will, after we do that, talk about, she's going to talk about NAMI North Carolina's legislative agenda. And how are we doing on time?
Doing great. 6.5 minutes.
Okay, one thing before I read the public policy, we have quarterly programs at our support group. In July, we're having a doctor who specializes in schizophrenia, and he's coming to answer questions about that illness. Smoky Mountain Center is going to do community resiliency model with us sometime soon. We're also going to have something on anger management, and I know there's one I'm forgetting. NAMI's public policy platform, the abbreviated version is on the table with our information, and so is NAMI's overview of the governor's budget. I don't have time to quite present that tonight, but if you're interested in that, that's also back there. NAMI North Carolina's public policy platform. Number 1 is advocate for increased access and funding for first episode psychosis programs. Advocate for use of screening for children and adolescents. Educate transitional youth regarding services such as individual placement support and first episode programs. expand recovery programs, reach educators in middle and high schools and secondary education to ensure they are aware of resources such as NAMI on campus, parents and teachers as allies, and youth mental health first aid. Support programs that allow students within the school system to have minimal disruption due to their illness. Number 2 is improve quality and length of life for those with severe mental illness through integrating primary and behavioral health care. This is exactly what they're talking about. Improve access to crisis service and psychiatric bed capacity through advocacy for more local beds and better use of existing beds. Expansion of existing capacity at state hospitals through staffing increases and expanding walk-in crisis centers throughout the state. Expanded use of psychiatric advanced directives in North Carolina. Ensure family and consumer engagement in shaping mental health services. Support an array of mental health services that are cost-effective, outcome-driven, and are recovery-oriented, such as peer support specialists. Number 3 is leverage our collaboration with the Prison Advisory Committee to ensure the health and safety of adults and juveniles with mental illness within the prison system and judicial justice system. Expand treatment model to one more prison. It's something that NAMI North Carolina is working on. Develop a dashboard report program for prisons to measure their progress. Improve treatment options to include evidence-based or promising practices. Expand CIT, crisis intervention training, to more prisons and start with parole and probation officers. Continue to support expansion of jail diversion programs. Number 4 is to develop independence and stability, reduction of emergency department usage through a system of available affordable housing. Expand the availability of the special assistance slots to help towards one more recovery. Advocate with the department to define a sustainable and adequate funding stream for room and board rates. Service array needs to include a service to provide training to acquire active, engaging community living skills. So they're not just housing them; they want to help them get better. Advocate for improved effectiveness and quality of facility-based crisis programs, ensuring that all accept individuals under involuntary commitments, and operate as supportive drop-off centers for law enforcement, families, and individuals. And that's what we've been talking about, is reducing the burden on our emergency services in our police department. Number 5 is improve the economic and personal self-sufficiency of individuals with mental illness through employment. Increase affiliate participation in advocating for IPS through their LME and MCO, and NAMI has had a representative attend the meetings for the employment services, 2 meetings, and we've also, I know a few people personally who've gotten work through that program, so that's fantastic. Okay, no, yeah, that's actually the last one. Marianne has one more thing.
I have a couple things. One is there's a definite correlation between substance use and mental illness. Most people who have abused drugs or alcohol have a co-occurring mental illness, because that's where we're trying to use that self-medication. I'm one of those who've been there, done that. Also, I wanted to let you know about the suicide rate. I got this. It's the latest CDC, Center for Disease Control, statistics on suicide. Starting with the highest, we have 100 counties. Starting with number 1 is Clay County is the highest. Macon County is number 6. Cherokee number 7. Haywood number 8. Graham number 11. Swain number 21. And Jackson number 31. So you can see a very high rate of suicide, and that does not include those who have tried but were not successful, who are thinking about it but have not yet acted on it. So I just wanted to say those are a couple of issues in addition to crisis that I personally am concerned about. We done?
Great.
Thank you all. We'll move right along.